Marfan syndrome. Marfan syndrome is inherited in an autosomal dominant manner. All individuals inherit 2 copies of each gene. At least 25% of Marfan syndrome cases result from a new, de novo, mutation in the FBN1 gene. These cases occur in people with no family history of the disorder. Marfan syndrome, MFS, is a genetic disorder of the connective tissue. People with Marfan tend to be tall and thin, with long arms, legs, fingers and toes. They also typically have flexible joints and scoliosis. The most serious complications involve the heart and aorta, with an increased risk of mitral valve prolapse and aortic aneurysm. Other commonly affected areas include the lungs, eyes, bones and the covering of the spinal cord. Marfan syndrome is inherited in an autosomal manner. MFS is caused by a mutation in FBN1, one of the genes that makes fibrillin, which results in abnormal connective tissue. About 75% of the time, the condition is inherited from a parent, while 25% of the time it is a new mutation. About 1 in 5,000 to 10,000 individuals have Marfan syndrome. 7. It occurs equally in males and females. Rates are similar between races and in different regions of the world. 7. It is named after Antoine Marfan, a French pediatrician who first described the condition in 1896. Most of the readily visible signs are associated with the skeletal system. Many individuals with Marfan syndrome grow to above average height, and some have disproportionately long, slender limbs with thin, weak wrists and long fingers and toes. Besides affecting height and limb proportions, people with Marfan syndrome may have abnormal lateral curvature of the spine, scoliosis, thoracic lordosis, abnormal indentation, pectus excavatum, or protrusion, pectus carinatum, of the sternum, abnormal joint flexibility, a high-arched palate with crowded teeth and an overbite, flat feet, hammer toes, stooped shoulders, and unexplained stretch marks on the skin. It can also cause pain in the joints, bones, and muscles. Some people with Marfan have speech disorders resulting from symptomatic high palates and small jaws. Early osteoarthritis may occur. Other signs include limited range of motion in the hips due to the femoral head protruding into abnormally deep hip sockets. Ectopia lentis in Marfan syndrome, zonular fibers are seen. Lens dislocation in Marfan syndrome with the lens being kidney-shaped and resting against the ciliary body. In Marfan syndrome, the health of the eye can be affected in many ways, but the principal change is partial lens dislocation, where the lens is shifted out of its normal position. This occurs because of weakness in the ciliary zonules, the connective tissue strands which suspend the lens within the eye. The mutations responsible for Marfan syndrome weaken the zonules and cause them to stretch. The inferior zonules are most frequently stretched, resulting in the lens shifting upwards and outwards, but it can shift in other directions as well. Nearsightedness, myopia, and blurred vision are common due to connective tissue defects in the eye. Farsightedness can also result, particularly if the lens is highly subluxated. Subluxation, partial dislocation, of the lens can be detected clinically in about 60% of people with Marfan syndrome by the use of a slit lamp biomicroscope. If the lens subluxation is subtle, then imaging with high-resolution ultrasound biomicroscopy might be used. Other signs and symptoms affecting the eye include increased length along an axis of the globe, myopia, corneal flatness, strabismus, exotropia, and esotropia. Those with MFS are also at a high risk for early glaucoma and early cataracts. Cardiovascular system. The most serious signs and symptoms associated with Marfan syndrome involve the cardiovascular system, undue fatigue, shortness of breath, heart palpitations, racing heartbeats, or chest pain radiating to the back, shoulder, or arm. Cold arms, hands, and feet can also be linked to MFS because of inadequate circulation. A heart murmur, abnormal reading on an ECG, or symptoms of angina can indicate further investigation. The signs of regurgitation from prolapse of the mitral or aortic valves, which control the flow of blood through the heart, result from cystic medial degeneration of the valves, which is commonly associated with MFS. See mitral valve prolapse, aortic regurgitation. However, the major sign that would lead a doctor to consider an underlying condition is a dilated aorta or an aortic aneurysm. Sometimes, no heart problems are apparent until the weakening of the connective tissue, cystic medial degeneration, in the ascending aorta causes an aortic aneurysm or aortic dissection, a surgical emergency. An aortic dissection is most often fatal and presents with pain radiating down the back, giving a tearing sensation. Because underlying connective tissue abnormalities cause MFS, the incidence of dehiscence of prosthetic mitral valve is increased. Care should be taken to attempt repair of damaged heart valves rather than replacement. Transforming gene factor beta, TGF-beta, plays an important role in MFS. Fibrillin-1 directly binds a latent form of TGF-beta, keeping it sequestered and unable to exert its biological activity. The simplest model suggests reduced levels of fibrillin-1 allow TGF-beta levels to rise due to inadequate sequestration. Although how elevated TGF-beta levels are responsible for the specific pathology seen with the disease is not proven, an inflammatory reaction releasing proteases that slowly degrade the elastic fibers and other components of the extracellular matrix is known to occur. The importance of the TGF-beta pathway was confirmed with the discovery of the similar Loeys-Dietz syndrome involving the TGF-beta-R2 gene on chromosome 3, a receptor protein of TGF-beta. Marfan syndrome has often been confused with Loeys-Dietz syndrome, because of the considerable clinical overlap between the two pathologies. Each parent with the condition has a 50% risk of passing the genetic defect onto any child due to its autosomal dominant nature. Most individuals with MFS have another affected family member. In fact, about 75% of cases are inherited. On the other hand, about 15 to 30% of all cases are due to de novo genetic mutations. Such spontaneous mutations occur in about 1 in 20,000 births. Marfan syndrome is also an example of dominant negative mutation, and haploinsufficiency. It is associated with variable expressivity. Incomplete penetrance has not been definitively documented.